get started now. Just a reminder, 30 minutes, one question, one follow-up. Today we have Dr. Williams and Dr. Heyer here, so I'll turn it over to them to get started.
Right. Good afternoon, everyone. And so it's Thursday, and we're looking back at how the week is going and what we're looking at the weekend coming up. So I have some comments to make in a number of areas regard to that. I'm pleased to be joined today by Dr. Dirk Heyer, our Chief Coroner for Ontario, and he's also the coordinator of the provincial outbreak response. And furthermore, he's also on the COVID-19 vaccine distribution task force. So I'll be making some comments, and then I'll ask Dr. Heyer to add his at the end before we go to the media for questions. So this has been a significant week for us as we look at the data and information that we spoke about on Monday. Besides the surpassing 200,000 confirmed COVID cases in Ontario since the pandemic began, we're also noting that today is our highest in a single day with 3,519 cases reported. We were hoping that by now we will start to see those numbers coming down, and in fact it's going the other way. We also noted that unfortunately we have recorded our highest number of deaths in a single day, 89. And while our modelers had said we would see that occurring, we did not want to see it going up that soon, that high. And that's unfortunate because they're not just numbers. They represent family members, whether parents, grandparents, sisters, brothers, etc. So there's significant losses to the family. And of course, we continue to express our condolences to them, and our thoughts are with them. We also are seeing, unfortunately, record numbers in our hospitals. And you've heard much in the media about that, with hospital services talking about being stretched, and especially in our areas of largest numbers, and I'll talk about that in a moment, with 1,472 people in hospital, and our ICU number is now up today up to 373. And as you know, that's well above what our models were talking about a week or so, 2 weeks ago, about being over the 350 mark, where you're going to start to see impacts on cancellation of other elective procedures. And indeed, in areas of highest uptake, we're seeing those cases being canceled and deferred. And that is unfortunate because we were hoping that through the lockdown we're going to start to see some numbers come down. As always, a lot of our cases are concentrated in our biggest areas, York, Peel, and Toronto. And they, in the past, would have made up 70 to 80% of our cases. Today, they're making up 54%. And that's even concerning because that means a lot of areas outside of those have gone up extensively. And such that as we look at the data across our area, we used to have about 6 or 8 in our so-called gray lockdown zone. If we use the same metric, we'd have now about 14 in that category. And we have in the past number in the green zone right now, as of on the New Year's period between Christmas and New Year's, we have only 1 remaining in green zone. And so a number of the areas, even out in the north, have gone up and are accruing cases beyond what they usually have been experienced in the fall. So this is a challenge we have ahead of us. And so what are we going to do with that? We're looking at the number of cases in our regions, many over 200. We have one in Windsor, Essex with over 300. And that has gone up. We had some that were very low before that through to an event, even during the lockdown period, where all of a sudden with a super spreader, they go from slightly above green to yellow and all of a sudden going right up to above that. And maybe Dr. Heyer will comment on that in his context of outbreak. So these things can flare up very fast and they don't go away very quickly. They continue to escalate and move through the community. And so where you were coasting with a few cases, you now have a lot of case contact management to undertake. In the past, where we looked at their Ontario average per 100,000, or I would say November, December, we were seeing that rate per 100,000 go up by about 5 each week. So that before the Christmas break and before the lockdown, we had 106 per 100,000. Now in the week just before New Year's, the last one, we've gone up to 129.8 per 100,000 in the 1 week. And that's a 23% increase. That's very concerning. And we look at that, how that was impacting on the time before Christmas as everybody, I would say, unfortunately, with information I'm receiving, a number were setting aside the principles of public health protection and being very casual about that, getting in congregate settings, groups, without masking, without distancing, and assuming that things are going to be going okay. And now we're seeing many, many more people coming forward and getting tested. And our testing rates, even on New Year's Day, was up to 70,000, over 70,000, one of our highest on record. So we're not dealing with small tests with high percent positivity. We're dealing with large numbers with high percent positivity, up to as high as 9.7, 9.8%, which we had not seen since the first wave. And then we're dealing with a very small number of test cases in there. So we're dealing with large numbers, large percent, large number of cases being reported. And the larger the cases are, the more percent of those go to the hospital, and the more those end up in the ICU. And in time, unfortunately, the more that'll impact long-term care facilities and also impact our deaths as they tend to be delayed. And perhaps Dr. O'Hara will want to comment on that further. At the same time, that puts a strain on our health units with case contact management. It puts a strain on our hospitals, which I've alluded to already, that are now pressing the limit on a number of areas around their ICU admissions, as well as canceling elective surgeries in and around the area, not just in Toronto now. We're spreading out through large parts of southern Ontario. So what does that mean? We have looked at the data carefully. We have had consultations. We looked at our Northern Ontario data. And as you recall, when we announced the lockdown, we were going to consider reviewing the Northern Ontario and whether we would have them come out of lockdown after 2 weeks, which would be this weekend. And as I said, our numbers there, where they had a whole bunch in green, now there's only one left in green. And there's one of our smaller ones is in the second week in the red zone. So their numbers have gone up. We had a teleconference and consultation with the 7 Northern Medical Officer of Health, and all were adamant they need to stay in lockdown. And they said their municipal leadership was feeling the same way. So as a result, we made that recommendation, and that has been ratified. So the Northern Health units will stay with the rest of the province in lockdown until the 23rd of January. But of course, we're going to continue looking at our data and information there, because now we should be coming out of the pre-Christmas, pre-Boxing Day lockdown time and seeing if we're having any impact, if people have hunkered down in a way, decided to adhere to the public health measures to reduce contact with other people in there, because besides the aspect of the cases going up, we also have now the advent of the UK variant. And maybe Dr. O'Hara want to comment on that, but we have detected 6 thus far, mostly related to travel. We are looking for it. We are trying to assess it and determine it better, but that means we have to put our guard up even further, because the data and information shows that it's wide transmission, very much easier communicability, and that has great impacts, as we've seen in other countries such as the UK and the Netherlands. So we have done that. Furthermore, as we said in the past, and have been lots of consultation with the Ministry of Education and with Minister Lecce, and we have looked at the data there. We are concerned in the fact that we had a very successful fall, in spite of lots of predictions to the opposite, where people said, due to cases and outbreaks, we'd be lucky if we stayed open till Thanksgiving. We stayed open all the way, right through until Christmas in class attendance. Why? One is that we didn't go with the pretense that nothing would happen. We went with the pretense that things would happen, that cases would show up at the schools. We added a number of checks and balances in there, IPAC principles, IPAC training, cohorting, masking, distancing, all the way through, and talking to the parents. We added public health nurses to the school system and that. And yes, we did see a lot of cases showing up at the schools. They arrived, they were sent home, they were followed up. We kept the outbreaks in the schools down to a limited amount. There was not a lot of extensive evidence of transmission in the schools, hardly any at all. We had a little bit in Windsor just before Christmas, and we know that's a concern to the medical officer there, and he has made it clear that he's going to keep the schools out of in-class attendance at this time, keep it virtual at least for the next 2 weeks beyond the 11th of January. So we looked at that and that information there. We know that with our modeling data and different information, we hope to update you on that in the near future. It is looking concerning very much. In there, our community transmission is the highest ever. At that time, we had hoped to be down. And before we went into Christmas, let's go back and say, in the fall when we opened up the schools, we said we're doing okay. We're only having 200 to 300 cases a day in the province. 200 to 300 cases a day. That seems like a long time ago. And before Christmas, we said, well, we're struggling. We're having 1,700, 1,800 a day. We were very concerned about that. We need a lockdown and bring it down. And some said, well, I'm not sure that's necessary because it's probably going to come down. It didn't come down. Now we're looking at every day over 3,000 and 3,500 today. I'm concerned we may jump up to 4,000. That means we have a large amount of community transmission. With that in mind, we have really sat down seriously looking at that. Why? In our province, long-term cares are very important. We've put a number of steps in there to protect that. We're looking at our schools, and we feel our schools are necessary and a vital requirement for the development and mental health and other aspects of our children. We have listened to the experts from various centres, including the Hospital for Sick Children. And we had a consultation with the Medical Officer of Health, especially in Southern Ontario. They're very strong, saying at this moment, we should not open up in class at this time. We should be careful. Can we defer that for another week or two till we look at the data? And can we put other things in place to add further protection around our schools from the high levels of community transmission? We're not talking about 3 or 4% in the community. We're talking at least 7, going up to 20 to 30% in some areas. That means there's people coming to the school, either students or some staff. We're going to have to be very stringent on how we survey that, monitor that, and document that, and making sure all those checks and balances, because in talking to our medical officers of health, and even in Southern Ontario, they say the schools are too important to have open and close and open and close. That would be very perplexing. Can we delay a week or two in class attendance and then open up, because we want to stay open? And we want to stay open on a permanent basis there for the rest of the school year, March break permitting, of course. And so with that, we have asked, and we are going to ask in the Southern Ontario, that instead of opening up to in-class on the 11th, and I know this is a tough one. It's tough for everybody. And we know those parents have worked hard at this, and having the virtual learning is not easy. But at the same time, I've had lots of correspondence, and I would say I open up one or lead one and says, don't be crazy. Keep the schools closed. Another one says, don't be crazy. Open up the schools. People are caught between the two. They see the value and the need of the schools open. Some are desperate to have the schools open for in-class attendance, and some are saying, I'm too worried, I probably won't send my children to school. So we want to make sure we put those things in place so that when we do open, all the checks and balances and further things that we're trying to develop right now in the next week and a half. So that's why we're deferring in-class attendance, not closing schools, for another 2 weeks in Southern Ontario, so we can get these other things in place in consultation with the Ministry of Education, with Minister Lecce, and between Minister Lecce and Minister Elliott, so we can ensure that's going to take place. Why? Because schools are that important. And we do not want to let the current high levels of community transmission, which is very disappointing, and one we have to really work hard at getting down, because you can see it's impacting our most valued resources. It's impacting our long-term care homes. We put all sorts of checks and balances. It's impacting our healthcare system, and it's going to compromise that, and it's impacting our school attendance at this time. And so we have to pull that back down and get it under control. So with much reluctance, I have asked and agreed by the Premier and Cabinet and the ministers to say, okay, we will defer opening in Southern Ontario. Northern Ontario can open for in-class attendance because their community rates are, at this time, low. Not insignificant. There's still concerns. That's why we're keeping them in lockdown, because they want to keep them in lockdown to keep their schools open. Why are we saying Northern Ontario? Because not only do they have lower rates, but because of the geography in that, they have less infrastructure for virtual learning. And we understand that sensitivity. While we're saying to hold and delay the opening of the schools, I've asked the Deputy Minister, besides being available for essential workers, that's childcare, and to make sure that those emergency workers have that, because of course a lot of our essential workers are mothers, are very concerned about that, and how do we make sure they have a safe place to have their children while they're there, to have school-aged children to be there in those care at that time, and to say, are there other special needs that we should be aware of, and allowing boards of education to look at those aspects there. So we're attentive to the community spread and impact on schools. We're attentive to the need to get the schools open. We're attentive to the fact there's very specific needs that right now are there that boards of education know, teachers know that they want to be accessible to. So we're trying to get the right balance here to ask for saying we're going to have a deferral of the opening for 2 weeks while we get these other things in place, because we want the schools open and we want them to stay open. So those are the main things I wanted to comment on this at this time. And with that, before we go to media, I'm going to ask Dr. Hire if he has any further comments to make in respect of his areas of responsibility.
Thank you very much, Dr. Williams. Good afternoon, everybody. You know, it's a sad day. Highest number of cases that we've ever reported. Highest number of deaths that we've ever reported. 22 out of 34 public health units has more than 10 cases. We have the hospitals who are struggling with intensive care unit, with patients being admitted to their hospitals, with outbreaks occurring throughout their hospitals, overcapacity as far as their ability to provide the care in many situations. We have public health units who aren't able to do all of the work that they are experts at doing and that they are trying to keep track of and trying to work on as hard as they can, doing the best that they can. They're still leading this response in a wonderful way, but still incredibly overcapacitated. All of this is very distressing and very sad. Schools are not being reopened. We remain in lockdown across the province. All in all, many, many factors that point to how devastating this illness is and how all of us need to work together to take all of the proper steps in a way to reduce transmission, eliminate in all ways possible the fact that COVID is spreading through and responding to that in our best way possible. On that, I think I'll pass over to Alex and open for questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
Your first question comes from Christina Tenalia with CP24. Please go ahead.
Hi there, Dr. Williams and Dr. Heyer. Thank you so much for taking my question here about this, just getting my audio back together here. I wanted to ask you about some of the comments you just made, how you noted that you're deferring and closing schools. Dr. Williams, you noted that there's a large amount of community transmission. You don't want that transmission to get more out of control, and you even noted that your anticipation, the modeling, the suggestion is it could hit 4,000 cases a day soon. So why only 2 weeks in terms of a closure? And I recognize that it has been well documented and reported the benefits of having kids in class, but parents, teachers, students want certainty.
Yes, well, thank you for that question. And as you may recall when we talked about it before, that while we were closing for the Christmas break, seasonal break, New Year's, etc., we had wanted the week of the 4th of January to be virtual in attendance because we wanted to see what the data looked like near the end of the that week of the 4th of January, this week, to see if indeed did our numbers stay the same before as they were pre-Christmas, pre-holiday. And in fact, were they coming down with some effects of the lockdown, the message around that even prior to the lockdown, people be very careful and cautious during the various festive seasons in that. And so here we are in the week of the 4th of January, and that number didn't come down because we thought if it did stay down and came down even further, let's open up the classes to in-class attendance. So we've seen that. Therefore, in that light of that, our methods that we put in place before in the fall, I think in my mind and opinion, have to be enhanced, especially around areas of surveillance and monitoring and promptness and readiness to assess those things on a very acute basis, because instead of having just one or two children coming once in a while to the schools, we may have quite a few coming to the schools. And at the same time, we want to make sure we're attentive to keep looking to make sure there's no evidence of the so-called UK variant. And we're looking at different systems of how to put that in place to monitor that, because as you may have heard in various media reports, it's higher transmissibility, and they say also more in children. It was concerning to me in some of the data by ICES over the holiday season with testing, where we were seeing with less than 3% in children attending schools, elementary I'm referring to here. Rates in those have been now at 5, 6, or 7% while they're not in school. So that's concerning. So we're going to have to get a lot better at that and put other things in balance. And so we're working with the Ministry of Education to say, in light of this, what are the further steps to put walls around our schools to protect and monitor that? So we're working hard at that right now, and we only have a week or so, a week and a half to get it all ready to go. And these are not simple things you just turn the switch on. You have to put a lot of things in place, and we're working at that right at this time.
But Dr. Williams, in terms of what you're going to be putting in place, I mean, is that long-term? Can parents anticipate a further extension of online learning? I mean, this is Thursday here. Parents are learning that on Monday, once again, students, this will be an extension of their online learning period. Parents are left scrambling. They want certainty. At what point is it that there will be another extension to this? And also considering that the COVID-19 vaccine is not recommended for children. So what's the long-term solution here?
I'm going to ask Dr. Heyer in a moment to comment about vaccine and its role in play in that. You make a very good point on that. What I'm saying is that by the methods here, we could have said, let's just go ahead and hope for the best. We want to put some more things in place because I know my fellow MOHs around the province, the Minister of Education and the Ministry of Education are saying we will defer in-class attendance for 2 weeks. We definitely would like to open up on that time, and we want to put those things in place. So rather than just saying, in light of the higher community spread, let's open as we did in the fall and hope for the best, I'm not satisfied with that. I want to put some more steps and protection in place. So when we do open up in 2 weeks, we want to do that. And so we're trying to drive the parents towards saying, let's say we are deferring for 2 weeks. I mean, 2 weeks, if everything all goes wild and we go up to 6,000 to 10,000 cases, we might be in a whole different situation. I'm assuming with the direction that we're going, people do what they need to do. Step back, be careful, do not transmit, do not encounter things, limit your travel, household, masking, all those things we said before, you really have to drive hard at. In this time too, besides what we're doing to protect the children, you can do your part. That means parents who have children, if you were casual over the holidays, get serious now. Limit those contacts and those issues there, especially related to travelers and aspects there, because you have this period to get that out of the system. And so you're doing your part to say, if my children are going to attend the school, they have not been in any contact with anyone of any concern in the last 4 days. Either have I as a parent or parents or caregivers, we have been careful. We're ready for that. Teachers preparing, custodial staff, administrative staff, some are already back in doing some special ed programs now. So this is all getting prepared up and getting refocused because we're going to have to really do all those things, because I definitely want to have in-class attendance in 2 weeks when we come out, and we have the lockdown coming out, looking at in 2 weeks as well on the 23rd.
I think it would be fantastic, and everybody desires certainty. Certainly understand the parents and the challenges that occur with schools and making decisions. COVID doesn't allow us certainty right now. Every effort we're trying to make together is to try to provide that certainty, try to provide what we know will happen tomorrow. But unfortunately, when we make plans, we don't always see what we hope would happen. We did not anticipate, and we hope that we wouldn't see the highest number of cases and the highest number of deaths today. And I really want to pause for a minute and recognize the loss people have suffered. Many different family members, many different communities, many different friends have lost their loved ones over the past many months, but especially so the number today. Not to diminish any of the ones before, but just to recognize that. And so certainty is very difficult within COVID. All of us would strive for that, and what we all strive for is a certainty that people think about all of the steps that they're taking, think about all of the things that they're doing, think about all of the places they go, think about all of the things that they intersect with and people they intersect with, and in all certainty prevent transmission. That's what we're striving for. That's what we need to look to do, and then we can be more certain as to the steps that we'll take in other things. Speaking about the vaccine, we have been actively involved in vaccinating based upon the logistics and based upon the number of vaccines that have been provided to Ontario. And now many hospitals have begun vaccination and are almost pushing towards vaccinating as many long-term care residents, staff, essential caregivers, and those who live in high-risk retirement homes, as well as healthcare workers. Children were not part of the initial studies, but over the clinical trials. But over time, there'll be more and more work done to look at children and how vaccination can occur, and hopefully with successful immunization of our older population and those at the greatest risk, that will contribute to the reduction of illness, and specifically serious illness and mortality, as we move away from and complete vaccination and immunization of the older population. Then we'll move towards those in the younger groups.
Next question.
Your next question comes from Laura Stone with the Globe and Mail. Please go ahead.
Hi, doctors. Dr. Williams, I'd like to know more about what you mean by putting up further walls around schools or enhancing the safety measures in schools over the next week or two. Can you be specific here? Are you talking about making class sizes smaller, improving ventilation, increasing testing, asymptomatic testing in schools? What exactly can and are you going to be doing to make schools safer if and when kids return?
So in some of those areas there, I know that the minister will probably be making some comments coming up in the next day or two about what further he is going to do. And so I'm not going to preempt him by what his comments are in some of those areas there. I'm mostly concerned about the idea or the aspect of testing and surveillance in there. As you know, we did change that in the fall a little bit, and we didn't have our testing methodology up as robust as we like. So therefore, some parents were left for periods of time in frustration, long lineups to get in, to get seen, and even longer to get the test turnaround time. I do not want that to reoccur. And so if we're going to make this a joint partnership with the parents and with others in that, we want to make sure we're going to run a robust program that will give them the information that we need, the information they need, and the information that the system needs to advise and give recommendations and direction in that as we seek to have raised the bar on our surveillance sensitivity, not only with symptomatic children, but we also will be including, of course, others along with that who may be asymptomatic but may be contacts of cases or potential cases. But we have to work how to put that in place. And as you can imagine, when you're dealing with not a few people, you're dealing with a lot of people, and you're going to set up a system, you're going to make sure you set it up well, because I do not want to frustrate the parents and the students and others with a system that is not ready to respond to the need. So that's why we've got to make sure we have it in place. That's my focus. I know that Minister Lecce has some other announcements to make, but I'll leave that for the minister to make in due time.
Follow up?
And earlier this week, the minister released a letter saying that schools would be returning as scheduled, and he and the government have repeatedly said that they are safe. So what has happened in the past 3 or 4 days to completely change the course of the government's plans? Is it that these numbers are tied to the holiday gatherings, or has something else happened that has caused this 180 in returning schools on Monday?
Right. And I would say the minister and I were in league with that, saying we want the schools open, and that was our plan. And as Dr. Heyer alluded to, one thing about viruses, especially this one cannot be too confident in what's going to occur. And even a week ago, we were saying, okay, once in a while we'll touch over 3,000. I think we'll get this back down shortly. That didn't happen. And here we are at 3,500, and the number of tests coming in are still going the other way. And so one of the aspects, one can't just say, well, let's be reckless, let's just go ahead and deal with it. One has to be responsive, one has to be responsible, and one has to be reactive to these situations as they arise. And that's only what I think our public health officials and the public expect us to do. And so our intentions are there. Like the minister, I'd like the school in class attendance back again. Our medical officers of health would like it back again. But not in the face of the numbers we're seeing in the last few days and today. And then throw into the mix, we have the influx of some early cases, there may be more, of the UK variant. And how are we going to make sure we're assured, one, it's not there, and if it is there, how are we going to pick it up very quickly if it does occur? So we got to ask ourselves that, because as of 2 weeks ago, we didn't see that. As a week or 2 weeks ago, places like the UK, their daily numbers were where we are, 2,000 or 3,000. That's a population, twice the population of Canada. And now, within a week and a short time, it just took off with the UK variant, and they're dealing with very crushing numbers as today. As Dr. Heyer said, one cannot be too presumptive when you're dealing with this. One has to be looking, testing, assessing, and responding to the situation that arises. So, like the minister, I would have liked to have everybody back in class on Monday, but in fairness and in care, we can't do that. We have to defer in-class attendance. The virtual is still open. I know that's a challenge, and they're going to be talking about that. And Mr. Lecce has some comments to make on that, I'm sure, in the next few days.
Next question.
Your next question comes from Sneha Agarwal with CBC News. Please go ahead.
Thank you for taking my question. Dr. Williams, clearly the numbers have been at record levels for weeks. Why are we only hearing about this extension of virtual learning Thursday before children were set to return on Monday?
Well, thank you. And I think I alluded to that. Maybe I didn't cover it very clearly. What we had hoped is that in the week of the 4th of January, with the incubation period and testing periods, and knowing that before the lockdown was going to be on the 6th at midnight, and if you go with the 10 to 12 days after that, that puts us in this week right now. So that as we saw this, and the data is indicating there was a lot of congregate type activity in the period before the lockdown date on midnight on Boxing Day, 12:01. So, I mean, would I like to see in the next few days and be proven that the lockdown had worked? It's a soft lockdown, that, and see those numbers start to come cascading down and percent positivity come down. I'd be one of the happiest persons in that. So that's why we delayed till now. That's why we asked that instead of opening up classes on Monday the 4th, we asked to say, could you back then defer and have in-class attendance virtual from the 4th to 11th? That's why schools had never had that before were delayed. Minister Lecce had hoped to open up, as the schools said, as they typically would have done, back on the 4th of January. We delayed a week to see what the data looks like. The data, now we've had this week to look at, and the days it starts to kick into gear would be yesterday and today. The numbers, as Dr. Hires alluded to, are very disappointing. And so that's why we've held on long as we could, because we had hoped we would be able to have some good messaging and say, everybody back to class on Monday. We said for the North, it's okay. For the South and throughout the South, it's not looking good. And so we have to take some more time to set things in place, to be cautious, to be protective, to get our schools open in 2 weeks from now, in class attendance that is, and stay open.
So there was a plan. There was a plan that was tied to the lockdown, and with the period of time that once the lockdown started, then that would limit transmission, limit the growth of the cases, limit the seriousness of this, allow the hospitals and the public health units to get back greater capacity. And unfortunately, the plan didn't go as was anticipated. And that's what leads to changes, unfortunately, at a time when it is close to the end of that particular plan. So this is obviously frustrating for everybody, obviously disappointing for everybody, but clearly the numbers keep going up despite the provincial lockdown that's been put in place.
Follow up?
Thank you. We know the government has been working with the NHL to find a way to let the Senators and Leafs play hockey in the upcoming NHL season. Ontarians and their children can't play hockey. The lockdown of North Ontario has been extended. Why should the provincial public health workers and officials be dealing with things of this nature, considering the amount of work you have just dealing with the spread of the virus?
So it's a good question. We have been looking at this for a period of time now. As you're aware, you may be aware, there has been extensive conversations between the NHL writ large, the Canadian teams across the country, the various provincial bodies that have NHL teams in their jurisdictions, federal authorities, and different ones like that. As you recall, in the fall, when we were having rising numbers, there was the question of in the spring, the NHL bubble where we had the competition, and there was concerns about that. We asked them to put together a plan, and they did a very comprehensive plan, for them, a costly plan that required a lot of resources, a lot of intense testing, a lot of limitations and restrictions on their players to do that, to keep it out there, because in a sense, while I know sports fans will say it's sports, it is entertainment. And we have an entertainment business that still is doing some preparation materials with very strict limitations and gatherings and multiple testing at their cost and expense. And so again, the NHL is putting a plan to us to say, can we do this? Because they feel that that would be valuable for the entertainment and for Canadians to see. But they're going to have to put a very comprehensive plan together that does not compromise, one, the health of any Ontarians in this situation, Canadians, other provinces and territories, no travel outside the country. So in that perspective, as well as very strict rules around who's in attendance, who can attend, how it's handled, multiple testing, regular testing, and very strict limitations on players' movements, etc. So we have considered this because it is done without compromising the testing capacity of the province, without cost to the public in this regard. And so we are assessing that at this time. We have not made a final decision. It's getting very close. We know that we've asked our counterparts in Ontario would be Ottawa and Toronto Public Health if they have any concerns or issues. We are still working with our federal counterparts and with my counterparts across the country, the other Chief Medical Officer of Health from the provinces of concern, namely British Columbia, Alberta, Manitoba, ourselves, and Quebec. And so that process is proceeding. It's not yet finalized, and I haven't signed off on it this time. But as I said, it's a program that is very intense and comprehensive, and that the organizers, the National Hockey League in the Canadian sector, have stringently looked at because it is a business venture, and they're dealing with large assets and resources, and you're dealing with professional players who have much at stake and have put their commitment to the whole process. So all those things considered, I can see why you think there's a dichotomy in the aspect there, but we have to be convinced, I have to be convinced that it's done with all the points I've made already before I would agree to sign off on it in that. And as I said before, we did the one with the bubble, and in spite of people's predictions, we did not have any consequences, and the players stuck to the task as they are, because they are professionals and it is their livelihood and they are business entities and look after it with that much care. So we'll have to see where it goes, and when we get the final approval, we'll be letting people know.
Last question.
Your final question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hello, doctors. Given your concern about the numbers topping 4,000 and how things could go wild if the UK variant comes here, what else do you think would be a good idea to do to curb the spread? Maybe the lockdown is working, but numbers keep getting higher. What more could you do?
So I've been asking our public health measures table, who will be meeting again, to say, okay, what other steps? We're asking our various experts from Public Health Ontario to look at other jurisdictions, what they are and have done. We're asking our modelers to look at other jurisdictions that have different steps they've taken beyond what we've done, to say what is its validity, I would say external application in our context. What could we do here? And in the aspect there, and as Dr. Hires alluded to already, while we do have a vaccination program rolling out rapidly at this time, we need another 2 or 3 months staying at our task of limiting this growth at this time. We are asking our laboratory people to look at better methods to look at early detection of UK variants. We've had some limitations, and you've seen the announcement by the Premier and ministers with travel and travel testing. So we're trying to lock all those things down to maintain those controls as best we can. And so we're going to be looking at a number of steps to ascertain what has worked, what hasn't worked. And a lot of the issues relate to people's personal behavior. And some of the early information we're receiving is we're not talking about a few percent. We're talking about like a significant amount of people have said they're not adhering, either masking or not adhering to maintaining distancing. They're having multiple gatherings of people and not maintaining those distancing while they're in there. And that is concerning, especially if they're congregating. Even worse, we find out with people over the ages of 65 and 70 with comorbidity, and really putting people at risk. And these are the ones that a lot of these are filling up our hospitals and our intensive care units, and unfortunately some are going on to early mortality in that. So we have a challenge ahead of us to put that in. So we're going to be looking at that, and I know the Premier and the Minister are looking for further recommendations from us in dealing with this matter.
Follow up, and this is the last question.
Do you think that curfews work, and how confident are you that Ontario is accurately tracking the UK variant? I'm surprised that it's still only 6 people, because that was the figure we heard on Monday.
So you got a 2-part question there. Curfew. We've seen other jurisdictions do it. Curfew means different things in different places and different levels. So what would be a curfew? How does it work? We know Quebec is announced. I know our Premier is going to be talking to Premier Legault and see how they're going to implement it there. Part of the challenge of a curfew is how are you going to enforce a curfew? How are you going to make sure that people are adhering to a curfew? And there's challenges in that. Depends on what the constraints are and the legal aspects, as well as enforcement tasks and documentation things. So we are. That's one of the things we will consider. We know that Australia did undertake that in the Melbourne area, and other countries have done some. Some have much different social structures than we have. So we're going to look at that as well and to see what they have. That's just one of the tools that are there. You're one about the variant. We know that all along we have been looking for variants anyways. So we just didn't start all of a sudden. So I've talked to our chief medical microbiologist, Dr. Allen, and said during the fall we've done close to 6,000 tests for genomic sequencing because we want to know how is it changing and altering anyways. And if it was happening already, we would have picked up some. They were very quick because one of the advantages of today's science world is that as soon as the so-called UK variant, the B117, that was shared internationally. So we have the sequencing here, and even now they're trying to look at developing some more specific testing that would allow our PCR testing to look for that in particular. But key to that is, of course, it's linked to travel and travel history, and then Dr. Heisel alluded to with their case contact management. We want to know if people have had contact with someone with travel, especially from the areas of high transmission of the so-called B117. We're also watching for the South African one. And as it goes on, you're getting more and more of these variants showing up because you get more and more transmission to more and more people in different ways. And that's just what coronavirus does. And so we're looking not only for the B117, the South African, we're also looking for any other significant variants. We have been, and we'll continue to do that with our laboratory system.
And Rob, just thanks for your questions. I think all of us want to figure out together how can we take additional steps? And it really is all of us working together. So I implore everybody who's on this call to think about ways to communicate the importance of taking steps individually, but also supporting others who are in positions that can't take steps so easily, people who live in different settings where they live with many different people, how to support others, how to support the reduction of transmission across all populations, across all of Ontario, so that we can move together to be able to reduce these numbers to a point that will allow us to work in a more efficient, a more open, and a more socially connected world in Ontario.
Thanks, everyone.